I don't really make content about cases because I'm not a lawyer, but this case has some emergency medicine training in it. So there is a ongoing trial about a woman named Karen Reed. If you don't know who she is or don't care, just scroll along. But essentially, there is a woman who's on trial for a crime that involved the loss of life, and her lawyer is doing a pretty good job of painting the picture that she may have been framed. Now, in the case, there's a piece of evidence that involves a young man with injuries over his knuckles. I'm going to try to find a picture of it. Now, I'm not going to really spend a lot of time looking for that photo, but this was from a piece thanks to That's News to Me. So you can see that there's a photo that involves what we call in emergency medicine as signs of a closed fist injury, or it is a closed fist injury. Now, the reason why that's important is because if you see that on an exam of a patient, you of course have to make sure that that injury isn't from one of violence, and you want to make sure that the patient is safe. But you also are curious, or should be curious, to know what caused the injury. Because if the injury was sustained from, for example, a punch to someone else's mouth, then that can lead to a very different treatment. Now, our knuckles are joints that have a thin layer of skin protecting them, and an injury involving a punch to someone else's mouth can lead to the transmission of normal bacteria that live in the mouth into the joint, which can lead to a dangerous infection that needs to be treated. Now, that infection can lead to a problem called tenosynovitis, or it can even lead to something like septic arthritis. These are very difficult infections to treat that can be life-changing for the patient. Now, back to the case, this person says that they sustained this injury from falling. And it reminded me about a case from a book about emergency medicine cases that I really like. It's called Bounce Backs. But this is literally the first case in this textbook. And I just think that some of the education here is interesting. For example, one of the quotes from this book is, patients with CFIs or closed fist injuries often have a history of recent alcohol use, are notoriously non-compliant, and frequently offer an alternative explanation for the cause of their injury. Now, in emergency medicine, you kind of sometimes have to do a little bit of an investigation to make sure that you are getting the right treatment to the patient, because if that history is missed and that patient doesn't get the appropriate antibiotics, they could end up bouncing back to the emergency room with a worsening infection, and they could possibly even have permanent disability because of that crucial information that was missed. So my education here to my TikTok med students is that whenever you see an injury like that to the dorsal surface of someone's knuckles, on the outside of their fists, you always have to ask more questions. And one quote that I always remember from this book is, "Not even apes who walk on their knuckles use them to protect themselves when they fall." All right, I thought that was interesting.